So no panic at this point in time, but we are seeing a bump up in cases. To find out more about what the situation on the ground is, especially across the Delhi NCR region, we're joined by Dr. Ashok Seth of Fortis and Dr. Ambrish Mittal of Max Healthcare. Doctors, thanks very much for joining us here on the program. Dr. Seth, let me start by asking you, we are seeing a pickup in cases across the NCR, in the capital as well. But what are you seeing on the ground? While hospitalization rates haven't picked up just yet, when you talk to people who are testing positive, are they reporting mild symptoms? What are they coming to hospitals or doctors with? What queries are they coming to doctors with?
So, Shirin, it's a very, very important question, and I think we all agree with the fact that there's no panic and the fact that this was to be expected as we normalize and learn to live with the virus. The virus is living amongst us, and therefore these bumps are expected. But that's true. We're not seeing serious cases. For example, we haven't had a single COVID admission for the last practically 4 weeks, despite the fact that we've got 40 beds of COVID available to us. And also for the fact that the only single patient who got admitted was an incidental finding of a COVID positive in a patient who'd come for another procedure. So that's the other aspect. Yes, the number of cases that you see arising are a reality, but I'm not concerned about the fact because these are mild cases, these are being treated at home, and that is the reason why they're isolated at home. Having said that, the normalization is appropriate. There's no question. I don't think we need to move backwards. We need to go forwards, and we're going to see this happening more and more, maybe less, maybe more. But what is important to understand is that we are now in a different world altogether compared to last 2 years ago. Vaccinations, double vaccinations are practically complete. There's another form of immunity related to past infections. And so the people are more, immunocompetent than they were against the COVID a year ago. But clearly, when we say mask mandate off, I'm slightly concerned that people will mistake it for the fact that now we can be careless and callous and that the COVID is not around us. I think what we should understand is that the responsibility lies with us now rather than mandates and rather than rules and regulations. And we continue to take precautions and be less callous and be more careful as we go along. Because yes, it can affect us. And let's not even forget that mild cases may not need hospitalization and vaccinations may prevent severe infections. But I still worry about the long COVID, which people do have and actually continues to, in some way, disturb our lives for months and months, even after a mild COVID infection.
Panel. But Dr. Seth, I want to address another issue with you. What we are now once again starting to see this reactionary move when it comes to schools, because there are cases being reported in schools, the move to shut down schools once again. Are you seeing any disproportionate increase in the number of children that are being reportedly down with COVID at this point in time? And what do you believe the way forward needs to be in being able to deal with this at the level of school? Because, as I pointed out, many authorities are now saying, okay, if there's a case, then shut down that wing or shut down the entire school all over again.
So very clearly, and I think unambiguously, the schools should not shut down. We need to move ahead. We can't actually sacrifice the education, and I mean all-round education of children at the altar of COVID any further. And we must also remember that it is COVID-appropriate behavior which is becoming more important in schools. We know that there's a large proportion of children who are now being vaccinated, and they should be double vaccinated, all above the age of 12 years. So we are actually seeing, and then again, we must remember that much of the children have already developed immunity through silent infections, and that's also been well documented. So I think we need to move ahead. I think of the very clear fact that at schools, yes, the distancing, the masking, the teachers being masked, emphasis on the COVID appropriate behavior, all becomes a part of the norm. But education should continue, and we certainly not really panicking about children and schools with a clear mandate that let's move ahead. We know how to actually make sure that this does not spread, and therefore certainly more precautions in schools. Let's not remember the mask mandate always concerns me that it was taken off, because really the responsibility now lies with school children, responsibility lies with the school teachers, responsibility lies with the school authorities. But those pictures have to be clear now. And again, one thing I would say for schools, please let's lay down the rules and regulations now for schools, and I would urge the government to actually come up with those issues. Say, for example, if a child does come to be positive, there's a panic within the school, there's a panic amongst parents. What are the isolation parameters? When does that child come back to school? How do you isolate a wing, or how do you actually clean that area? All those are important aspects, but the schools don't stop. Education continues.